So welcome back. Today we will be talking about a disease called vasculitis. And this is simply where the immune system is overactive the wrong way and attacking the blood vessels on the inside of the body, creating a disease on the outside of the body. It was first discovered in 1866 by two German physicians by the name of Dr. Kuzma and Dr. Maya. And what had happened is there was a journeyman tailor by the name of Carl who was only 27. And for over a year, he had been very sick, but he had been kind of working his way from his village all the way to the University of Freiburg Hospital, which, remember, at that time, hospitals were not ubiquitous. They were not everywhere. They were only attached to major medical centers. And unfortunately, by the time he reached the hospital, he was very sick and he died very quickly. But Dr. Kuzma, being an internist, and Dr. Maya, being a pathologist, were able to do his autopsy and discover that the actual blood vessels that were going to all his organs were being attacked. They were being affected. And they described the first known case of vasculitis. And in fact, they described one of the most rare types, one that happens in 1 out of 1,000,000 people or even more. And if you look at it, vasculitis is actually a very rare disease. If you take the example of how many people do I need in a room for even one person to get this disease, it's well over 20,000. As far as the risk factors of vasculitis, it's very difficult because, yes, the people above the age of 60 do get more of this disease. However, there are certain vasculitises that happen in younger patients, such as the first patient, Carl, who was only 27. There are gender differences in this disease, but again, it really depends on the vasculitis. There are certain types that happen more in men and certain types that happen more in women, depending again on the age and the type of vasculitis. There is a genetic component, but again, we don't know how much is there. But when a patient has vasculitis, sometimes their family members have had a history of having it as well. And then finally, anything that's really irritating that immune system to become overactive the wrong way, such as another autoimmune disease, certain infections, certain medications, smoking for sure, and certain drugs like cocaine. Now, when it comes to the symptoms of vasculitis, they really have to be divided up into two major parts, because one is what we would call general symptoms, which is present in all patients with vasculitis, meaning they have low-grade fevers, they're losing weight for no reason, they are very tired, and usually the symptoms are going on for a few months or more. The second category are patients have symptoms depending on the type of vasculitis they're having, meaning what type of blood vessel is being affected, what size is it, and where is it in the body. So for instance, the large vessel vasculitis, meaning attacking the blood vessels that are going to the head or going to the arms, those patients will have more headaches, they may have more jaw claudication or pain with chewing their food, they can get sudden vision changes, and they can get arm claudication or basically a tiredness with using of their arms, and they can get different blood pressures in each arm when you compare them. When patients have medium vessel vasculitis, these are the medium blood vessels that are going directly to the kidney and some nerves, so they may have more kidney problems and more nerve problems. When it comes to patients with small vessel vasculitis, in this case, it is the blood vessels that are going to the ends of the nose, the ends of the lungs, the ends of the kidney, and the skin that are being attacked. So these patients will have nosebleeds, they are coughing up blood, they are urinating or peeing out blood, and they will have red rashes. Then the other category is variable, which means in this case, the vasculitis is happening in any size blood vessel, and it can happen in arteries, which have muscles, and veins, which are more like straws. They're very thin-walled. And in these patients, a lot of different symptoms can happen, including the eye can get attacked, they can get sores in their mouth, they can get rashes, etc. And in these patients, it seems that the blood vessels are left more sticky, so they can get more blood clots and strokes, etc. And then the final category is what we call the secondary category, which means that the patient already has another autoimmune rheumatological disease, and the vasculitis is just a part of that. So for instance, rheumatoid vasculitis or lupus vasculitis, etc. So as you can tell, diagnosis of vasculitis is very, very difficult. You have to take what the patient is saying and match it up with the correct symptoms and match it up with what is happening on their body. There are lab tests for vasculitis, but they're not very specific. They're not unique to this disease. There can be a lot of mimickers of it. Sometimes scans are needed, like chest x-rays or CAT scans, etc. Sometimes a biopsy is needed where a sample of a blood vessel is taken and then you can look at it underneath a microscope and you can see the inflammation taking place. But most importantly, it's just ruling out other diseases, because remember, vasculitis is a very, very rare. So other things that can give patients these same symptoms, like thyroid disease or infections or cancers, medications, etc. When it comes to the treatment of vasculitis, is just like the treatment of any other autoimmune rheumatological disease for the most part, where you push down the immune system and the disease does go away. However, you always put the patient at risk for infection or cancer, so you have to be sure about the diagnosis. And in these patients, what seems to be unique is now these blood vessels that used to be nice and straight are now kind of rough on the inside, so they are at more risk for heart attacks and strokes, so they may need an aspirin to keep the blood a little bit slippery. As far as the prognosis of vasculitis goes, it really depends on the type of vasculitis, where it is in the body, how quickly it is diagnosed, how well it is treated, and how well the patient's body responds to that treatment. But I will say that before the 1970s or so, we didn't have very good medications for this disease. So to give you an example, for every 10 people that had vasculitis and were treated, only about 1 or even 2 would be alive about a year later. And now we've reversed those numbers. So now we've turned it into a very survivable disease, meaning that patients with treatment are expected to live. As the father of Western medicine, Hippocrates, would say, healing is a matter of time, but sometimes it is also a matter of opportunity. Until we meet again.